Hi, my name is Jessica Wu, and I'm a general surgery resident at the University of Southern California, and I just want to thank SAGES for this opportunity to present our study. I have no disclosures. Health literacy is considered a social determinant of health and plays an integral role in patient care outcomes. It is defined as patients' knowledge, motivation, and competencies to access, understand, appraise, and apply health information in order to make judgments and decisions in everyday life concerning healthcare, disease prevention, and healthcare promotion. It is estimated that greater than 1/3 of the U.S. adult population has low health literacy. Unfortunately, it has been shown that health literacy is associated with poor health outcomes and higher mortality rates. Safety net hospitals provide medical care to underserved populations of low socioeconomic populations and diverse ethnic backgrounds. Studies have shown that patients managed at safety net hospitals are vulnerable to low health literacy and are at risk for poor health care outcomes. There are two objectives for this study. First aim was to implement a preoperative hernia seminar at a safety net hospital. Second aim was to analyze its effects on improving knowledge of ventral hernia symptoms and surgical management. The preoperative hernia education seminar was implemented in July of 2022. All new patients who were referred to our minimally invasive clinic for ventral hernia repairs attended the hernia education seminar prior to being scheduled with a clinic visit with the surgeons. The seminar is a 20-minute session consisted of an 8-minute hernia overview video and a question-answer session with a nurse practitioner. The video, narrated in English and Spanish, reviewed ventral hernia symptoms, potential complications secondary to hernias, pre-surgical optimization criteria, surgical options, expected surgery outcomes, and post-operative complications. At the end of the seminar, patients who are interested in pursuing surgical repair were scheduled for a MIS clinic appointment. Additional labs and imaging, if needed, were ordered at the time of the seminar, so all needed information would be available at the clinic visit. Patients were also given the QR code and an internet hyperlink for the hernia information video, so they would have the opportunity to refer to the video at home. At the end, each patient was given a 10-question survey at the end of the seminar. The survey, written in English and in Spanish, asked questions comparing the patient's knowledge before and after the seminar with regards to the definition of a hernia and hernia repair operations. The questions were asked in a dichotomous yes or no format. The last question of the survey asked patients for additional comments or improvements to the hernia video or seminar. And then the survey answers were analyzed to study the effect of the seminar on patients' knowledge and understanding of hernias and hernia surgery. A total of 446 patients participated in the preoperative hernia seminar from July 2022 to July 2023. The majority of patients spoke Spanish as their primary language. 434 patients found the seminar helpful to watch prior to their surgery clinic appointment, and 434 patients felt that more comfortable pursuing surgery after attending the seminar. In the comments section of the survey, majority of responses mentioned that the seminar was perfect and very informative. Patients felt that the video and seminar helped explain all the information needed to make them feel comfortable to pursue hernia surgery. However, there were some patients who felt that the seminar could provide more information regarding the details of surgery and thought that the seminar was a waste of time to attend. Prior to attending the seminar, 146 patients did not understand their hernia diagnosis, and 268 patients did not know the details of hernia surgery. However, of the 146 patients who initially did not understand their hernia diagnosis, 139 patients stated better understanding of what a hernia is after attending the seminar. Additionally, of the 268 patients who did not know the preoperative details of hernia surgery prior to the seminar, 255 patients felt the seminar helped give a better understanding of what to expect with hernia surgery. 12 patients did not feel comfortable pursuing hernia surgery after attending the hernia seminar. Of these 12 patients, 8 patients stated that the hernia seminar helped better understand what to expect with hernia surgery, and 9 patients felt that all their questions were answered with the seminar. And also, 8 patients found the seminar helpful to attend. 12 patients did not find the seminar beneficial to attend prior to their surgery clinic. 6 of these patients did not understand the hernia diagnosis or details of hernia surgery prior to the seminar. However, a majority of patients found the seminar beneficial in better understanding hernia symptoms and hernia surgery. Additionally, 10 patients stated that all their questions were answered by the video and seminar, and 10 patients felt comfortable pursuing hernia surgery. There are several limitations to this study. Several key demographic details were not included in the study, including age, gender, ethnicity, highest education level, social economic status, insurance status, and access to internet resources. Additionally, it would have been beneficial to use a health literacy assessment tool to better determine the patient's baseline health literacy level. These factors could have played a role in assessing the effects of the seminar on improving patients' hernia knowledge base. Our study demonstrates that hernia information seminars are effective in improving health knowledge regarding hernia diagnosis and hernia surgery. Majority of patients felt that the seminar was beneficial to attend prior to their clinic visit and felt more comfortable pursuing hernia surgery after attending the seminar. The seminar gave patients a greater overview of what symptoms to expect with hernias and what to expect with undergoing hernia surgery. This allows patients to have the ability to make an informed decision prior to pursuing surgery. Thank you.